patients in the NHS with A1C over 7.5. And we all know the dreaded hypoglycemia. So, just putting it into perspective, this is the SAGE study. It's a global observational analysis of glycemic control, and it included about 3,500 patients. 50% of patients developed one or more hypoglycemic episode in the last 3 months that was symptomatic. And about 12% of patients in the last 6 months developed more than one severe hypoglycemic episode, which means that they required assistance with that episode. So still pretty alarming numbers. Our patients, people with type 1 diabetes, are definitely not living a normal life. But what works in regards to improving these glycemic parameters? So this is a study, I'm sure Dr. Ahmed had alluded to this yesterday, that the more you check your blood sugars, the lower the A1C. And really, it requires about 10 or more self-monitoring episodes in a day to achieve that A1C target of around 7 to 7.5%. What also works is that the more boluses the patients receive per day, that improves their control. So it's not the total daily insulin dose, it's actually how much of that insulin is given as a bolus. And that, as you can see, as the number of boluses increases, their A1C improves. So we conclude from this is that we need a lot more monitoring and a lot of boluses. And that's really where an insulin pump plays a role. So we know that things that lower A1C are frequent testing, frequent boluses, rapid insulin, accurate carb counting, easy bolus calculations, easy history, basal that can be adjusted to the precise needs of the patient, and then the bolus that's based on carbs and the blood sugar readings, and properly set doses.